So today in our series on understanding and solving examination questions, we are going to focus on a question under the topic of sepsis. Okay, so before going to the question itself, let us first understand what is sepsis. So we know that infections are mostly concerned with certain parts of the body. For example, if you're talking about the infection of the lungs, it's called pneumonia. If it's an infection of the brain, it's called meningitis. If it's an infection of the skin, it's called cellulitis or abscess. Or if it is of the heart, it is called infective endocarditis. So similarly, any kind of infection which is concerned with any part of the body is mostly localized. Now, when this same infection becomes more severe and enters the bloodstream, this condition is called sepsis. So this is basically a more generalized form of infection and most importantly, possibly a life-threatening form of the infection. So that is sepsis. So you can say that sepsis is basically a generalized infection which has now entered the bloodstream and it can be life-threatening for the patient. Okay. So now coming to the question itself. The case scenario is as follows. It says a 67-year-old male is brought to the emergency department by his wife due to fever, confusion, and weakness for the past 12 hours. He has a history of type 2 diabetes mellitus, hypertension, and chronic kidney disease. His medications include metformin, lisinopril, and aspirin. Okay. So let us first focus on this part where they are talking about the symptoms, his previous history, and his medications. So symptoms are patient is having fever, he's confused, and he's having severe weakness. Okay. So this is basically for the past 12 hours. So it's not a very long duration problem. So it is mostly an acute problem which has developed over a period of 12 hours. And in his past history, he has type 2 diabetes mellitus, he has hypertension, and he has chronic kidney disease. And his medications include metformin for the diabetes, lisinopril for the hypertension, and aspirin, which is, as we know, blood thinner. It's an antiplatelet agent, and this is meant mostly for the prevention of stroke. So this is his past history and medication. Now, what are the signs? On examination, the patient is febrile. He's having 1 or 2 degrees Fahrenheit temperature. Tachycardic, his heart rate is 115. And hypotensive, he's having 85/50 blood pressure, and he's tachypneic. Okay, his oxygen saturation is 95% on room air. He appears lethargic but follows simple commands. Skin examination reveals erythema, swelling, and warmth of the right lower extremity with an ulcer on the dorsum of the foot. Okay, so now let us stop here before going to the lab findings. So the patient is febrile. He's having 1 or 2 degrees Fahrenheit. So this is the first sign that the patient is having an infection. Okay. Then he's tachycardic. Of course, tachycardia is associated with a high temperature. So he is having a heart rate of 115. Then he's hypotensive. Now, this is something that we'll come to in the end. So let us focus on the next point, which is the tachypnea. He's tachypneic. So his respiratory rate, which is usually in the range of 16 to 18 per minute, is now increased to 22 per minute. And his oxygen saturation is 95%, which is not a big concern because it is okay. It's not too bad. 95% on room air. He appears lethargic, but follows simple commands. That means he is confused, but he's not so confused as to be in a coma or unconscious. He is able to follow simple commands. Then skin examination reveals erythema, swelling, and warmth of the right lower extremity with an ulcer on the dorsum of the foot. Now remember, this patient has diabetes mellitus and he is a candidate for developing these foot ulcers. And here there is not only the foot ulcer is there, but also there is a right lower extremity erythema and swelling and warmth, which is an indication of cellulitis. So the patient's ulcer has now progressed to a state of cellulitis. And coming back to our signs, the most important thing in this is the hypotension, as we said. So hypotension, that is 85 by 50. Okay. So when you associate this sign of hypotension along with the other signs, which is fever, tachypnea, tachycardia, and erythema, swelling, and warmth of the right lower extremity, our conclusion should go directly to sepsis. Because in the presence of sepsis, the patient is usually presents with the given scenario. So in sepsis, what happens is because of the bloodstream infection, the patient may get worsened and then he may have the low blood pressure, which is a sign here, present here, which is hypotension. And now let us go to the lab findings. Lab findings, the WBC count is 18,500, which is a classic finding of infection where he's having neutrophilia, 85%, which is indicative of probably a bacterial infection. So he has a raised WBC count indicative of infection along with neutrophilia indicative of a bacterial infection. Lactate, which is usually less than 2, it is also raised to 4.2. So lactate is another sign of sepsis. It's a raised